the role of healthcare providers, payers, and investors in driving ethics and integrity. Health providers, payers, and investors from both the public and private sectors serve an integral role in the functioning of every health system and in how patients access the care they need. What we're really talking about is the healthcare ecosystem. There's so many components to the healthcare ecosystem, and it's got to work well, and it's got to work efficiently to really serve the patients that we all are united by. If we're brutally honest with ourselves, the ecosystem in all parts of the world, including this region, has not been working that effectively, has not been working that efficiently, and is not highly equitable in many examples. These are not new issues. This is nothing new to us. But the pandemic experience that we've all shared over these past 18 months and are really continuing to share have highlighted and exacerbated the inefficiency, the ineffectiveness, and the inequity that our healthcare system and the ecosystem, the present state of it. The need to urgently address that as we go forward has never been more urgent. As I said, it's been under the spotlight now. Doing so rashly, doing so knee-jerk, in imperfect ways is not going to help the situation. It can only make it worse. The need to come together as a healthcare ecosystem and drive good policy, and frankly, enable ethical innovation is really the opportunity and the challenge that we have as we go forward. It's a perfect setup for this topic. We have two great, it's what is the role of integrity and ethics in helping to drive and enable that ethical innovation that will make our healthcare ecosystem all the more efficient, all the more effective, and all the more equitable. And in turn, that's what the patients need that we're here to serve. So I'm delighted this is the conversation. This is the focus of this conversation. We've got two fantastic panelists here that I'm honored to moderate, and let me introduce them now to help us jump right through this. We're joined by Chris McCahan, Chief Investment Officer and Global Sector Lead of Health for the International Finance Corporation of the World Bank Group. And we're also joined by Bruno Sobral de Carvalho, Executive Secretary, National Health Confederation, Brazil. Bruno and Chris, thanks for being here. Really great to see you guys, and I really appreciate your time and look forward to your insights. So let's just jump right in if we can. Chris, if you don't mind, I'll start with you if that's okay. Heard a lot about EPIC and the work that you've been doing there over the last many years. I wonder if you can elaborate on EPIC or the EPIC initiative, ethical principles in healthcare, that's currently underway for the world's private healthcare providers, payers, and investors. What is it? Why is it important for the region? What successes have you seen in this work, and what more can all the stakeholders do to kind of progress it? So, Chris, thank you.
Thank you very much, Rady. I think you set the scene very well. EPIC, as you said, it stands for the Ethical Principles in Healthcare. And very basically, it's a set of 10 fundamental and universally applicable principles that can help guide the ethical behavior of healthcare providers, as well as their investors and their payers, insurance companies, et cetera. So it's really meant to address the whole healthcare delivery ecosystem that you were talking about that needs some work. The International Finance Corporation, my organization, developed EPIC together with our sister organization, the World Bank, a few years ago, but together with actually a wide group of folks that we consulted with and that provided input into EPIC, into the 10 principles. They included, CSOs, wide-ranging ethical experts, academia, other developmental institutions, policymakers, and of course, private healthcare companies and practitioners. While we developed EPIC and supported EPIC through IFC and the World Bank, we really considered a collective action initiative. It's no longer really an IFC product or IFC principles. It's really meant for the healthcare world, for the healthcare delivery world. And we've set up an independent secretariat and run it very much as an independent initiative, rather than something that's within IFC's four walls. The 10 EPIC principles cover sort of a wide range of areas. Everything from patient safety, staff safety, environmental and social stewardship. There's even a principle around, how do organizations deal with new ethical dilemmas that might come up, which they might not have experienced in the past. So it's pretty all-encompassing, yet simple in the fact that it's 10 principles and really meant for all geographies and all sorts of healthcare providers and their investors. Maybe I'll touch on sort of why we developed EPIC, and it may be two reasons. One is we are a large investor in private healthcare and in emerging markets. We have about a $3 billion portfolio on IFC's balance sheet. And we felt from that angle it was quite important for us and our clients, the investees that we work with, to sort of have a common framework that we're talking about when we're talking about ethical behavior. The last thing we want to do as a development institution or as a private investor is to work with companies that aren't working ethically, because it adds a tremendous risk to that investment, and frankly is not good for the overall health system. And that's really the second reason we developed this, is besides an investor, we're a developmental institution. So in order to enhance or promote or to strengthen the healthcare ecosystem that you were mentioning, we felt it was very important to distill or promulgate these principles, especially in the emerging markets. And when we looked out into the world, we found there were no existing sets of ethical principles out there for private healthcare providers to follow. Lots in the medical technology field, lots in the pharmaceutical industry, but nothing really addressed specifically for healthcare providers. The last was probably in 1999, or the closest to 1999, these Tavistock principles that were developed at that time, but not really widely taken up, but were useful as we developed EPIC. So we developed EPIC along with 20 like-minded healthcare providers as founding signatories that endorsed EPIC, and we've been working very closely with them on how to sort of further develop EPIC. We now have 170 signatories under this initiative, and we look for all private providers that are interested in doing things ethically and working with us on this initiative to also sign up, as well as their investors and as well as their payors. And you can go to epihc.org to see more. We're really thinking that this is a big tent initiative. We want to get as many organizations under this tent as possible, so we can start sharing best practices, resources, discuss ethical dilemmas that may come up in operations more and more as we grow that tent bigger. And I'll have to say, maybe a bit in closing this question, Rady, we've had tremendous uptake in Latin America region, as well as globally. I mean, we have signatories from every continent, but particularly in Latin America, there's been a lot of interest in this. And a bit of a surprise to us, we've been able to sign up a number of actually healthcare associations, as well as just providers, and Bruno can maybe talk about this a little bit more. But we're also working with these associations to further disseminate EPIC to their members, and I think it's a useful tool for those associations as well. So I'll stop there, Rady, but thank you very much.
No, that was phenomenal, Chris. Thank you. It was really a fantastic kind of historical contextual overview, and it's very impressive, the momentum and the progress that you seem to have made. Interestingly, part of the reasoning for doing it was you helped to fill a void. It just wasn't there. And something as simple as that and stepping into the breach helps provide a lot of guidance, and your big tent visual is very compelling, because that's what we need. We all are in the tent. There's lots of things. We're all in different parts of businesses and different parts of the ecosystem, but this is something we have in common, this goal. So, and hopefully the momentum can continue given the urgency of what we're facing. Bruno, maybe I can turn to you with the next question, if it's okay. Thank you again for being here. Can you elaborate a little bit more and further insight, share further your insights and learnings with us from the Brazilian perspective? How are providers and payers seeking to collaborate on trust building activities?
Ok, muito obrigado pelo convite, agradeço aí imensamente. A Confederação Nacional de Saúde é uma confederação sindical patronal, ela representa os hospitais e laboratórios no Brasil, os provedores de serviços de saúde, que em geral provêm esse serviço de saúde às operadoras de plano de saúde, que são os pagadores, né? Há algum tempo atrás, a Confederação, né, que é um trade union, recebia e vivia de verbas do taxpayer, né, de verba de impostos. No Brasil, até pouco tempo atrás, todos os sindicatos recebiam uma contribuição dos trabalhadores e das empresas, que são contribuições obrigatórias, eram impostos. Com a reforma trabalhista há 4 anos atrás, perdão, esse imposto caiu, não existia mais imposto para suportar, e a gente, obviamente, foi um momento que eu entrei na Confederação e a gente viu a necessidade de buscar novas fontes de financiamento, e em especial com os nossos representados. E imediatamente percebemos também que a gente precisaria mudar não só a governança da entidade, como, obviamente, aspectos éticos ligados às suas atividades, né? Aspectos de antitrust, aspectos de relacionamento com autoridades, tudo isso precisa ser mudado. E nós começamos um processo para mudar isso. Tivemos a sorte, durante esse processo, de conhecer o EPIC, e, a partir da interação com eles, incorporar nas nossas políticas que ainda estão sendo construídas vários dos princípios que foram colocados pelo EPIC, e essa technical assistance deles nos deu bastante apoio e principalmente também a certeza de que estávamos caminhando numa direção correta. Então, hoje nós estamos para soltar as nossas novas políticas éticas e de anticorrupção, e eu de antemão agradeço todo o apoio que a gente recebeu do EPIC nesse processo. Falando brevemente também sobre o mercado como em si, como as questões éticas permeiam esse mercado, é sempre comum falar que nessa relação entre o pagador e o provedor de serviços de saúde, os problemas éticos estão, em geral, na forma com a qual o pagador, o prestador de serviço cobram pelos seus serviços, e muitas vezes qual é o potencial que tem nessa relação do provedor de saúde colocar aí um uso exagerado de insumos, a utilização de insumos não necessários e caros, que seriam não só antiéticos, como poderiam prejudicar a saúde do paciente. E a gente, como representante desses provedores, admite essa possibilidade, no entanto, deixando claro que isso tem sido cada vez menos praticado no Brasil, e obviamente que isso está associado sempre a um modelo de pagamento fee for service, né? Então, quando você tem um pagamento por fee for service, há um incentivo econômico para fazer isso, deixando de lado isso quando não se leva em consideração as questões éticas envolvidas. Os prestadores brasileiros de saúde têm se envolvido cada vez mais nessas questões éticas, têm entendido cada vez mais a importância de comportamentos éticos adequados, e isso mesmo sem a mudança do modelo de pagamento, que eventualmente uma mudança de modelo de pagamento desejável em algum ponto. Ela não é possível ser mudada totalmente, mas para alguns pontos é desejável que mudemos o modelo de pagamento. Mesmo sem isso, os comportamentos têm mudado muito, não só nos provedores, como na própria indústria, né? Agora, esse é o lado que tem sempre sido abordado, mas eu gostaria de abordar um lado adicional, né? A gente sabe que o setor, a economia de saúde nos diz que você tem uma brutal assimetria de informação entre pacientes e os tomadores de cuidado, né, os cuidadores na saúde, né, especiais médicos, etc. O que a gente tem visto também é a falta de debate sobre o comportamento de quem cuida da saúde das pessoas, né? Então, quando fala de ética, fala do uso inadequado de um stent, por exemplo. poderia não ter sido usado, ser usado mais barato, ou eventualmente uma modificação qualquer, causada por um desvio ético. Mas não se fala em nenhum momento quais são os desvios éticos na relação com este paciente que levaram este paciente a precisar de um stent. Ou seja, só para dar um exemplo pessoal, meu pai teve uma doença cardíaca aos 60 anos, o meu tio, que é irmão dele, teve uma doença cardíaca aos 60 anos, e meu outro tio, que é irmão dele, teve uma doença cardíaca aos 70 anos. Nunca me perguntaram sobre isso. Nunca ninguém me perguntou sobre isso. Eu questiono também se não terem me perguntado, não terem tentado gerenciar a minha saúde, também não implica um dilema ético importante a ser discutido. Né? Óbvio que tem pessoas mais e menos esclarecidas sobre as suas necessidades de saúde, mas, em geral, por conta da simetria de informação, as pessoas não são educadas em se cuidar. Né? Então, quando um sistema de saúde, que em geral é gerenciado pelos pagadores, detecta um câncer no estágio 3 e 4, e não detecta esse mesmo câncer no estágio 1 e 2, por falta de comunicação, por falta de cuidado, por falta de interação, por falta de coleta de informação, eu me pergunto também se isso também não é um dilema ético a ser enfrentado e a ser debatido. Né? O sistema de saúde como um todo precisa ser ético. Os prestadores precisam ser éticos no uso dos seus insumos, mas eu acho que o ecossistema como um todo precisa ser ético no sentido de tratar melhor as pessoas, cuidar melhor das pessoas, num mundo em que tem uma simetria de informação muito grande e que as pessoas muitas vezes perdem oportunidades de serem tratadas antes, de maneira mais adequada, porque falta o cuidado à saúde. E a pergunta que vem é de quem é a responsabilidade por esse cuidado à saúde. Né? Hoje, os prestadores não são pagos para fazer esse cuidado à saúde. Né? Então, em geral, eu imagino que aqui no Brasil, principalmente, esse cuidado à saúde deveria ser feito em conjunto, obviamente, com os prestadores, mas ter promovido e provocado pelos pagadores, pelos planos de saúde. Eu acho que esse é um debate importante, esse é um debate que a gente não está fazendo no Brasil e que eu acho que precisa ser feito. Muito obrigado mais uma vez.
Thank you, Bruno. And boy, those were compelling and vivid examples of what some of the problems are that we're dealing with. I guess one comment I would make is I was encouraged by your discussion, your references to the fact that the notion of needing to be ethical is embraced now. People want to be ethical. We're not having the fight that we might have had some time ago about people not caring about that. So integrity and ethics are accepted notions that people aspire to. But your examples, especially the one involving the cardiac situations with your family members, and the lack of the information symmetry concerns, is just one of many examples of how big the problems are that we try to solve, but we need to. It leads into another question, if I can, and maybe for both of you, and I'm going to mix up a little bit of the order, just because the information symmetry question leads nicely into a question I wanted to ask about technology. Actually, maybe the next couple of questions I'll like to get thoughts from both of you on, if I can. But Bruno, if your voice isn't too parched from talking, if you can keep talking, I'd like to maybe stick with you in the first instance and ask you about the technology question, and then I'll go to Chris. But can you share your thoughts on the role of emerging health technologies and health data, and how they are driving new opportunities for strengthening patient care, for efficiency in the system, and the ethical considerations that kind of come with that? It's technology is a wonderful thing if used in the right way. It has, as we've learned through history, can have dark downsides as well. But I'd love to get your thoughts on that as well, and then maybe Chris, a follow-up.
Concordo que as tecnologias de saúde são um excelente driver de mudança. Eu acho que o principal problema, como eu já mencionei anteriormente, desse setor, o problema econômico já detectado há algum tempo, é o problema de assimetria de informação. Então, em primeiro lugar, eu acho que a tecnologia de informação pode cobrir a tecnologia pode cobrir esse gap, né? Talvez tornar os pacientes mais educados sobre a sua própria saúde, sobre as suas próprias necessidades, sempre tendo cuidado que o médico sempre continuará sendo, sempre será importante, né? A gente jamais vai prescindir da importância do profissional de saúde, porque parte é tecnologia, parte é arte, né, na medicina. Na minha opinião, eu não sou médico, sou engenheiro, mas eu acredito piamente que tem um componente de talento e de arte na medicina que nunca vai se perder. Agora, é fato que a tecnologia em saúde elas vão trazer para o mercado um paciente melhor informado, um paciente mais consciente e entendendo melhor, inclusive, os dilemas éticos envolvidos no seu cuidado, e mais capaz de cobrar um sistema de saúde que seja centrado nele como paciente. Eu acho que se a tecnologia conseguir isso, ela conseguiu dar um excelente passo para a gente ter melhor saúde por menor custo.
Thank you for that as well. And before I pass the mic to you, Chris, just comment on the patient, my own comment on the patient role, significantly increasing role for patients to be responsible, to be an active participant, to be their own advocate, which is we have to develop, but at the same time, the inequity in the system and kind of a lot of different positions. And it's easier for some people to do that than it is for other people to do that. And kind of keeping that in mind as we go forward is going to be another major issue to try to address in an equitable way. Chris, I didn't mean to interrupt the flow of the conversation, but can you add to your thoughts on the question I posed with technology?
Yeah, no, absolutely, Rady. And just right at the outset, let me just agree with Bruno. There's no way we're ever going to replace the doctors. They have to be central to all of this. I mean, obviously, along with the patients. But technology as a tool can help us deliver better healthcare. And I think there's no doubt that we've seen digital solutions disrupt health provision, most starkly during COVID with telehealth and the rise of that. And it's become clear to I think a lot of us working into this space, their tremendous potential of digital health. Not just in treating patients, but in diagnosing patients, in public health and tracking COVID, et cetera, and also in that more of that patient-doctor interface and patient services, as well as all of the back office stuff that goes on in a hospital or clinical setting. Digital health is a huge opportunity to improve that. Everything we do as an investor in private healthcare and emerging markets is centered around enhancing or improving quality, access, and affordability to healthcare. And I think digital solutions, digital technology has potential to affect all of those areas. So that's why we're very much focused on this space going forward. However, let me just say, it has to be implemented correctly, appropriately. Technology is just a tool. Data are just data. They're just building blocks, and unless you sort of put them together in the right ways and have the supporting infrastructure and really ingrain them into the overall processes and operations of your business, as well as the overall health system, they're going to fall flat. It's really part of that overall ecosystem that you were talking about, and they're really just pieces that need to be put together in the right way and aligned. So business models need to adjust. You can't use your same business model going forward without adjusting it for the technology that you're implementing. So there are ethical concerns that go along with this around patient rights and privacy and security, but I think these are all manageable. Regulations may be slower to adapt to digital technology than we're seeing actually providers adopting these technologies. So there's a lot of sort of incomplete regulations, gray areas it makes it difficult for private sector providers to operate in this space. But I think they'll catch up. I think they're quickly catching up, and obviously these regulations are important to protect patient privacy and those rights. So I think that's it. I mean, maybe just one sort of example, Rady, that we had someone come in and talk about interoperability of technology, which I think is another huge subject. I mean, you can't just, all of this technology needs to be able to work together. both at the facility level, but also within the broader health system level. And that's a challenge in of itself. This person who came in and spoke to us about this showed a picture of an airplane cockpit, and then a picture of an ICU bed. And obviously the airplane cockpit, all the instruments are talking to each other. They're all designed to help the pilot, guide the airplane, all very seamless. And then the ICU picture, you have wires going everywhere and different machines saying different things and not really helping the different machines work together. So I think that's kind of where we are, and where we need to get to is more of that cockpit approach with technology. Thanks.
A funny yet sobering visual for sure. In fact, maybe it answers the question, the quick follow-up question I was going to ask you. Your call to action earlier about business models needing to adjust. Are you seeing that happen, or actually in stating it, is it a call to action? We need to get on that quickly.
I think we need to get on it quickly, and actually it's a perfect day for you to ask me that question, because we've just actually announced or launched a technical assistance or advisory program around that specific area called DigiHealth, which we're piloting now in Sri Lanka and Asia with a leading hospital group there to help them actually address that specific issue. But we'll be developing this and actually launching it worldwide and working with a number of institutions on helping them through that journey. I think we're at the beginning point, a lot to be done, but a lot of institutions are ready to move that way.
Well, that's great. Both your comments really touched on the need for the call to action, but to be positive, because the opportunity for it to be such a solution in so many ways is outstanding. And frankly, the pandemic has given us an opportunity to test and pilot and get used to some of this stuff in ways that we never would have had before. So people should not be so fearful of the transition and the culture and business model changes that really need to come. And it's got to be done as part of with an ecosystem efficiency in mind. So my next question, again, I'll start with you this time, Chris, and then have Bruno follow up. Bringing it back to the investors, I guess, if I can. And you touched on this a little bit in response to your first question, but maybe we can go a little bit deeper. And my question is, you, but also your sense of investors at large, other investors, and ESG is obviously such a focus for everybody these days in that context. But is the ethical and the focus of ethics and integrity and compliance and all that stuff how big a factor is that for investors really right now? And have you seen an evolution in how if they are thinking about it? Have you seen an evolution in how they think about it? One that, not just, I hope these guys don't get in trouble, and versus, what, because these guys take this so seriously, I actually am very optimistic about their chance to be an innovative leader going forward. So they view it as a harbinger of future longer term success. Are we on that? And if we're not moving down that spectrum, what would it take to get investors to think of us that way?
Yeah, I think you answered the question with the question. Yeah, absolutely. I think the world has evolved and it's changing, and us as an investor, it's absolutely the first thing, the fundamental thing we would look for from a potential investee is making sure we share sort of those common values and ethics, because it underpins everything, right? You can't trust the financial statements of the company if they're not, operating ethically. It adds huge risk, right? Because of scandals and things that could happen. So it's really the fundamental thing. But I would say it's not kind of a black and white thing either. It's really an evolution and a journey. So we try to work with companies that obviously are operating ethically. That's sort of has to be there, but that are also interested in aspiring and improving, constantly improving and doing things better. And maybe I'll just give one example. Is we're working with we've invested in a leading hospital company in the Middle East, and by all accounts, they're operating ethically. They do things the right way. They're transparent. They have the proper governance in place. But they're using Epic, for example, around I think it's the Epic number 6 of the 10 principles around patient safety and patient rights, and really relooking at how they seek informed consent from the patients, how they make sure patients are involved in the care process, and basically looking how they can do things better. And we love that because we think it's a journey, and we think there's always a way to learn from others and self-reflect and just do things in a better way. So I think that's the mentality most, I think at least the good investors, right? The ones that you want to work with as an institution, that's kind of the first and foremost thing they're looking for these days.
That's helpful. It's encouraging. I think there's more. It's an encouraging incentive. I think with like you say, with the right investors, and hope people wake up to that. Continue to wake up to that. Bruno, could I ask you to share any reflections or thoughts you have on top of Chris's comment?
Sure. I don't have much to add on that, but just to give you a brief overview on how the Brazilian market is going and how can be opportunities for investors and how it's related to ethics. We had a very fragmented market, especially with providers, with small hospitals, all scattered all over Brazil. And we are presently going forward with two things. One is a consolidation. There's a big fight for market share in Brazil. So a lot of mergers and acquisitions going on. And the other drive is a lot of health companies going public. Going public is not a guarantee that the companies will act ethically, but it helps a lot. It helps a lot when you move to public, to list in you sell shares. Because you have to comply with a lot of ethical and anti-corruptions, and you have to be more transparent in your finance. It doesn't mean that you are ethical in what Epic calls health ethics, but I believe with those bigger companies, the level of society overview on them increases. So what we've been seeing here is that those companies are getting bigger. They're going public, but they are also seeking for more ethical principles implemented and presented to the society.
Very helpful. It makes me, you said in a few seconds ago, you made a reference, which is something it's an occupational hazard for all of us. When we think of ethics and compliance, if you are always looking and referring to just what the regulator or the legislation might or might not say, especially now, given the topics that you touched on, whether it's technology or investor expectations, you're going to be waiting around. The legislators, they can't keep up with the pace of everything. And the real opportunity is not to mess it up along the way. So when the regulators and the legislators do catch up, they have to be very punitive. Try to really, whether it's investors who sparked provide the incentive or the other just good ethical and integrity behavior to lead the way. Because I think in my own view, the solution to so much of what we're struggling with in society these days is going to require, and I used the phrase earlier, ethical innovation. Now, innovation can be a scary word, and because it's always new, sometimes people aren't sure what to do with it. And sometimes the reaction can be to not allow it, or to overregulate it, or to kind of suffocate it unintentionally. And we've got to find that right balance, I think, and the opportunity for the participants in the healthcare ecosystem to seize this moment where there is such focus and such need and such an opportunity to kind of lead the way, so that in co-creating this with governments and legislators along the way, you strike a balance of more efficient and more effective a place to be. So I leave a conversation like this a little bit overwhelmed, because the challenges ahead of us are enormous, but inspired by the answers that you both have provided to the discussion and the questions today. And frankly, I'll close with the EPIC principles. It's great that people are aligned and want to achieve this. Something as fundamentally sound as the EPIC principles are such an amazing starting point, and embracing that together, and talking with each other and across the ecosystem, I think is something that there is a readiness to do now more than probably ever. And I'm hopeful that coming out of the pandemic experience, if nothing else, this is a momentum that we will all seize and really strive to make more significant, faster process than would ever have been possible, recognizing how fundamentally critical sustainable ethics and integrity really is, not from staying out of trouble perspective, but being successful perspective and really giving patients what we all strive to give them. So with 19 seconds left, there's a big clock here that's counting me down. I just want to thank you both and thank you for giving me the opportunity to be on this great discussion with you. Really, really enjoyed it.